Welcome back once again, and with us over the phone is Dr. Islam Anan, Health Policy and Health Economic Advisor. Good morning, Dr. Anan.
Good morning, Dina. Happy to be with you as usual.
Same to you. It's a real pleasure having you today, Dr. Anan. Of course, if we talk about the goals of health initiatives, we will never stop, because goals were so many, and there was a lot of success achieved behind those goals. So let us talk about the achievements of 100 million lives, especially that this particular campaign or series of campaigns achieved success not only in Egypt but in other brotherly African countries also.
Yes, that's correct, and that's absolutely a great question to start with. Because if we are talking about the main goals, as you started your question, of the national health initiatives and the presidential health initiatives in Egypt, and speaking particularly about the 100 million health campaign, it's all about the prevention concept, and it was actually dragged from Egypt Vision 2030, which is ensure that all Egyptians, not all patients, have healthier life. So focusing on the person-centric approach, which is prevention, is way far better than just treating diseases. The campaigns are centered around the prevention and as well as early detection and equitable access to them, of course, for healthcare, which is very important. If I can screen and early detect, I need to ensure that all citizens get actually a fair access to healthcare. For years, since 2018 and since the launch of 100 million صحة, 100 million health, our healthcare model changed dramatically from the treatment-centric approach, as I was saying, and reaching the person-centric. Having said that, the aim is simple. The aim is actually to detect disease early, provide free treatment where needed, and educate citizens, which is very important, to become active participants in their own health journey. Because if we are talking about the person-centric approach and 100 million health, we need to emphasize on a new angle that was not tackled in many ways, which is people are actually responsible for the health from public health perspective. We need to educate them. They need, for example, to know that smoking is got a lot of health hazards, so the smoking cessation campaigns will work. They need to know that eating healthy is better, so all the presidential initiatives talking about diet and nutrition will work. So it's a multidisciplinary and it's a multidimensional one. And for example, if we're taking one example like hepatitis C, you are screening 50 million Egyptians, you wouldn't have reached a target of 50 million unless you have an education arm, you have a free treatment arm, and you got the capacity to do the screening itself and meeting the WHO elimination criteria, of course. And beyond, of course, hepatitis, which we've been discussing a lot in the show, we got a lot of initiatives targeting non-communicable diseases like diabetes, hypertension, obesity. We got the maternal and fetal health, we got the child nutrition, the hearing loss. And if we are actually looking at the 15 presidential initiatives launched since 2018, we'll find it actually covering the whole life journey of Egyptians, from birth, or even if we go beyond that, from premarital counseling, premarital screening, till the follow-up of pregnant women for viral diseases, which is the Mother and Fetus Prevention Campaign. And then since birth, we got a lot of campaigns. We got the genetic testing for the newborn. We got the the school children campaigns, which is obesity, stunting, and anemia. Until we are reaching senior citizens and geriatric age, we do have the 15 presidential initiatives. So the more impressive about what we are saying, which is covering the journey, is we are covering it because of two aspects, clinical and economic. From clinical aspect, of course, it's very obvious that enhancing the health of Egyptians will be leading a better quality of life. But talking about economically as well, each one of the 15 presidential initiatives are actually generating a return on investment. The prevention is always better than cure, as we were all the time saying that $1 spent in preventive care will save $4 in curative care. Hepatitis C, the 1 Egyptian pound spent, for example, for prevention and screening, yielded 3.6 Egyptian pounds in return. So to sum up, the goals are early detection, universal access, and add to that economic efficiency to lead and build a healthier and more resilient population in Egypt.
Right. How have campaigns like 100 Million Lives and other campaigns alike that were launched by the Egyptian administration and the Ministry of Health changed the modern map of medical services?
So if we're talking about the epidemiology map and the health map of Egypt, it changed dramatically because if we are talking about infectious diseases, for example, we had a lot of campaigns. So we do have zero malaria currently. We do have zero polio. We do have zero hepatitis C on the road of elimination of hepatitis C with the WHO. We got the campaign for hepatitis B. We got campaigns for dengue fever. So if we're talking infectious, the epidemiology map changed dramatically. One of the best preventive measures in the Middle East and Africa were actually recognized as Egypt, as mentioned by the WHO. If we are talking non-communicable, that's the current challenge of the developed and the developing countries. Because currently we do have an increased incidence and prevalence of all the non-communicable diseases like hypertension, diabetes, dyslipidemia, and obesity, of course. However, taking action for that can be just to treat, or as we were mentioning in my previous answer, is trying to either early detect or to prevent, to screen. And the data-driven design that was done, this is the first step. Egypt currently backed by real-time data analysis to understand first what should we manage, because you need to measure it before you manage it. And the citizens' results were recorded digitally for follow-up appointments and tracking and so on. This will enable us to have better, at least, control and better plans. And the main problem of the non-communicable diseases, diabetes and hypertension, is actually the control level. In the developing countries and LIMAC countries, which is low to middle income countries like Egypt, the control level of diabetes, for example, is like 20%. And in some citizen countries, it reaches 12 and 14% only. Same goes for hypertension, which is a very low percentage. So the leadership here actually is how to make sure that we do have, if we do have patients, are they controlled or not? We need to track the results. And if we do have an incidence, we need to decrease the incidence by making a screening awareness, making people actually to eat healthier, move more, and try to make sure that if there are actually any genetic factors that will lead to a non-communicable diseases, that we are tracking it and follow up to make sure that if the patient is a pre-diabetic, for example, you can detect the pre-diabetes earlier than expected, so it's not discovered late in a bad state, in a bad prognosis, and so on.
Right. On that note, of course, Dr. Islam Anan, Health Policy and Health Economic Advisor, would like to thank you, sir, so much talking to us, and you have a good day. And by this, we come to the end of this edition of The Breakfast Show. Many thanks to all of you. Until we see you again tomorrow morning, that's a goodbye.